three locations where a breast implant can be placed. Here's a little bit about what you should know about each. The first plane is subglandular. That's when the implant is placed directly under the breast tissue itself, but on top of the muscle. Second of all, you've got submuscular, in which the implant is placed below the muscle itself. We're talking about the pectoralis muscle. It should be known that when we go submuscular, it's rarely totally under the muscle. It's normally what we call dual plane, or at least the bottom portion is not under the muscle itself. And then the last plane is going to be called subfascial. That's where it's kind of an in-between plane, where it's above the muscle, below the breast tissue, but it's actually underneath the covering that's generally over the muscle, which is called fascia. So those are the three planes: subglandular, subfascial, and submuscular. So what are the pros and cons of each? So subglandular, the pros of it is it tends to be an easier recovery because you're not lifting up the muscle, so there's less pain or discomfort. At the same time, you don't have to deal with what's called an animation deformity. That's when you flex your chest muscles where the implant will shift in with the muscle itself. So those are the pros of the subglandular. And the cons of it is that because it doesn't have muscle coverage, a lot of time the implant itself can be palpable and visible, especially the top portion of it. And so rippling might be visible as well. So subglandular is really only good for two different types of patients: patients who already have a decent amount of breast tissue to provide camouflage for the implant, as well as bodybuilders who don't want to deal with the animation deformity. Second of all, we've got submuscular. This is a classic plane where the implant mostly goes under the muscle itself. The pros of it is that you're not going to have really implant edge visibility. There's not going to be rippling visibility because the muscle provides coverage. At the same time, you're going to have lower rates of what's called capsular contracture, which is the #1 most common complication of breast augmentation surgery over the long term. That's when you kind of a hardening shell around the implant itself. Now, what are the cons of submuscular is you will definitely deal with an animation deformity because it's underneath the muscle itself. And then you'll have a little bit more of a difficult recovery in terms of pain and discomfort for the first few days because you're having to lift up the muscle. That's submuscular. Lastly, we have subfascial. That's kind of your in-between phase. And the pros of it is that you're getting a little bit more coverage because it's not under the muscle, but you are getting it under that protective covering, the fascia that's on top of the muscle. Hypothetically, there's maybe lower rates of capsular contracture. Also, it should not be as uncomfortable a recovery as submuscular because you're not going totally under the muscle itself. At the same time, some of the cons are going to be you may still see potentially some rippling and implant visibility because you're not under the muscle itself. And there you have it. Those are the three planes. You've got your subglandular, submuscular, as well as subfascial. If you want to have any more questions or comments answered, you can DM me, you can message me, or you can follow the link in my profile above, as well as schedule a consultation.